I see it's 4 o'clock, so I call this meeting of the Adams Board of Health to order today on the 29th of September, 2021, 4 p.m. I should just read our waiver. In person and virtual participation in this meeting is allowed by Chapter 20 of the Act of 2021, suspending certain provisions of the open meeting law, Mass General Law, Chapter 30, Section 20. The Zoom information is given on the agenda. This meeting will be recorded via Zoom. You heard that. A copy can be provided upon request. I also added my telephone number to the agenda in case someone is trying to having problems getting in via the usual Zoom route. And so what I would like to do, because Superintendent Barrett is here, is ask for a motion to move the water superintendent's report to the top of the agenda.
Motion to amend the agenda to move water department top.
Discussion. So, Joyce?
Yes.
Pete?
Yes.
Dave? Yes. Unanimously passed. Welcome, John. Thank you for coming, and thank you for sending the documents. If I could just have a brief preview to the ones that I find most interesting. The water system improvements. You revised it for 2021. So adding to the original water main replacements, the hydrant replacements, you have added upgrade of the Glen Street pump station, as well as SCADA upgrades, and most importantly, rehab of well number 3. And then you had a detailed report on well number 3, noting that that and well number 4 are our main 2 wells that are used off and on throughout the year. The issue with well 3 is the pump is very old, and there's not a backup generator. And in order to safely repair or whatever well 4, we would need to rely on well 3, and therefore it's a 2-year plan starting next year, going through 2024 to replace the pump, upgrade the system completely. And so that sounds, and to add a gas powered generator. And then the other 2 reports of import, I thought the lead and copper, that this is an annual report. And you explained that certain houses in the town are chosen because of their use of lead and copper in the piping and solder. Turns out that 20 samples of each, we were below the threshold. In fact, many of the samples, particularly for lead, read 0. So, and as you point out, the source of those contaminants are actually from the household lines and not from the water system itself. And then finally, the chlorine report, that this is quarterly. You have to send in samples to measure byproducts of chlorination, which are cancer causing, the halomethanes and the haloacetic acids. And again, there was nothing detectable. So, so cheers, great job. Anything you would like to add
No, really, you covered all the bases. I just wanted to send the report out there because, as you mentioned, it does have the lead and copper results on there. And you know, they are, you know, you can see that, you know, if there is zero, you know, it would be in the distribution system. If there was something coming from the public water supply, you would see the minimal results in there. A big thing they pinpoint on these, and you're going to be seeing this coming to the forefront pretty soon, is that on a federal level, they are revising the lead and copper rule. So this is going to be changing. You're going to be seeing me putting out some public notices pretty soon. I got to make public of people who have lead lines, lead service lines. We don't have any in Adams. We don't have any lead pigtails. So for us, we are fortunate that it's mainly just, like you said, leaded joints inside of houses where they can get from, and could also be acquainted to improper sampling by the homeowner. If there's any hot water that is in the sample, that actually registers improperly within the sample. But for the most part, we've always been pretty good with lead and copper. We just got done doing them at a little bit more of a substantial pace because we, whenever you do a chemical change, that can affect the entire system. So for us, that was the addition of chlorine. Obviously, chlorine can lower the pH of the water, and that can have a vast effect on the reaction of the water in the piping and everything else. We're lucky for us, we don't. Again, so now this bleeds into the Chlorine Report and disinfection byproduct rule. We really don't add a lot of chlorine because we are a groundwater supply. So I believe in that report, I actually even put in there what I normally try to maintain. We are basically injecting, we're closer to the minimum level than the maximum level by far. And you know, and it works out pretty good. And I don't see anything really wrong. You know, I mean, we're in pretty good shape with that. And as you stated, I think the project evaluation form was in there. So when we do a master plan and create an asset management plan, we tried to populate you know, we try to give everything a term of use, and we try to replace all them things before that usage gets to the point of failure. And so, but again, you know, when you do this, it's at the point you write that report, that's when it's accurate. From that day on, it may not be. And so that's kind of where we're at with well 3. It's kind of degraded a little bit more. We're running into a little bit of issues with well 4, and we just need to be where we can have a well that can, you know, pump water with no problem, so that if I need to take well 4 offline, I can. You know, we also have another well. We have 3 wells that supply water, but well 3 is the only one that more than can double the capacity that the town uses on an hourly on a minute and hourly basis. So it is a big supplier of water, and it will be good if we can get the funding for it. That's really what that is. We're kind of at step 1, which would be the project evaluation form for submittal in the state revolving fund. And I'm hopefully confident that with the Infrastructure Act and everything that we're all seeing on the news, if that's all a go, hopefully we'll see an influx of funds in there. And we'll have to see, you know, there's a lot of other measures that are we're gonna have to meet, but hopefully we can get this project done, and it'll be good for all of us.
Thank you. A little bit off the subject, I heard through the grapevine that in the road renovation.
Yes.
Renovation, they're a wooden pipe.
Yes. So the wooden pipes, they were not. They're not directly they weren't the fire district's pipes per se. So, but while they were doing it, you know, there was a lot of train tracks from the trolley that had gone down through there, and so then as luck would have it, they were at a depth where we came across the wooden main, and the wooden main actually was utilized for water that served the, oh man, it's the mill where McDonald's used to be, right? It's actually where our Susan B. Anthony statue is now. That used to be a mill, and where the housing complex is now, that was the other part of the mill. So them two mills used to get water from, and there were water wheels in there, and that water was transferred from that mill up the street down to that mill near where McDonald's is now. And that was what we uncovered. And the Historic Society actually had a plan, and since I read plans all the time, I kind of had known what the symbols were. They were really old plans, and so they used that to run the mill, and then there's some fire protection plans in there as well. They actually have that now. We stored it here when we pulled it out because we knew the value of finding that. I had never seen one in my entire life except for in a museum. I always heard about one, so I thought it was an excellent opportunity. We halted construction, and Maximilian happily honored that. Took lunch break, and we went to it and cut that out. And we actually got a seam that we cut out where they mended the two logs together. You can see actually how they had burned the inside out, which was kind of way ahead of time, because now we all have, we all know that we have carbon filters, and it filters out things the carbon does. And as luck would have it, when they burn them trees out, the carbon residue is left there. So it was an interesting thing to see, and they have that up there, and I believe they hopefully will be putting it on display if they find room for it. So they have possession of that now, but it was not a potable water pipe.
Okay.
Wow.
That's good.
Cool.
Well, thank you. Any other questions from Mark or the? So, well, thank you very much. I appreciate you always being willing to give us the full story. You take care. Have a good evening.
Yes, I will. Thank you for having me. Always a pleasure, guys.
So the next order on the agenda I have here is public comment. So hearing none, we don't have a scheduled public hearing per se. Approval of minutes for September 9 and September 15. I do apologize. I did not have the opportunity to read through these. I looked at them, but not carefully. It's possible we can postpone those two.
I have one change that for September 9th. Did we get the 15th?
I didn't finish that.
Okay, yeah, so, okay. So it says Board of Health members present.
Yes.
I was not at that meeting,
Oh, you're right, you were not.
and I'm also not vice chair.
Choice is, right?
Yeah. Pick out a new person.
So that was the 1 o'clock meeting where
Right.
I was in that.
That was probably a copy and paste from a prior one, so my
Right.
apologies.
Yeah, so I painful memories, so I have delayed going through them word by word, but so we'll just hold those to the next meeting. And
Yep.
next to that addition meeting. So I would actually move on to old business. We have asked to hold 103 Front Street because we did not need to deal with that until next month. And so the next here is a Valley Street, and we see that Mr. Chuck is available, Mr. Chuck. So I will turn the floor over to Officer Blaisdell to see and what you think the next steps are.
Okay, so if I may first begin with making an apology to the board as well as to Ed. The first draft for the order to demolish that I submitted for the last meeting actually did contain some omissions from the template that I took from Pittsfield. So Ed is correct. So I was incorrect in stating that the format was reviewed by the Pittsfield board and passed the scrutiny of the courts. So I have since amended or made the proper edits to the order to demolish and sent you and Ed the draft. I have been to the property last week from Mr. Chuck's permission, accessed the house from the rear and took photos and
I do have some photos. I don't know if it's got it in.
One that you sent us.
okay, so that's one of the back. And then there are photos of the interior.
Share. Share. This series right here, I don't know if it's large enough to see, but this is looking into the back door lunchroom. I think I can scroll, okay, can scroll. Kitchen, is there, do you want me to stop?
No, go right ahead.
Listed as the dining room. See the debris up there to the left. Panels hanging from the ceiling. This is living room question. Again, a lot of debris, door open.
And gaps in the floorboards.
Oh, those are floorboards. That's not steps.
Correct.
Oh.
Okay, I thought they were steps.
So I did also have a conversation with former code enforcement officer Scott Casella, and that's cover over the collapsing foundation.
Oh, that's okay.
So that's what that is. I wasn't going to go any further than I had gone inside the house. Because I felt that I felt safety reasons. So I have had a conversation with Scott Casella. He described the condition of the property as I did view it. I did have a on-premises discussion with Mr. Chuck on Monday. I did give him some alternatives as far as dispensing of the property. He didn't sound like he objected to the order to demolish. As a matter of fact, he wanted to give the town permission right away to go onto the property to effect the demolition. Well, that can't happen at this time. But I told him it could happen down the road if the board so ordered it. I did approach one of the budding neighbors on his behalf, and Mr. Chuck has posted the property for sale by owner, showing his confirmed cell phone number. And when he's given an opportunity to speak, he can advise the board whether or not he's got any inquiries since Monday. So based on the prior, the 2011 condemnation by Officer Casella, and based on my refreshed condemnation and views of the property, I asked the board to order the property demolished using the third draft that I most recently provided to you.
So we need to vote to issue that order to demolish.
Yes, but maybe we'd like to speak with Mr. Chuck first.
Mr. Chuck, would, do you have anything to say?
Mark said like you said, what happened off the building. The property.
So if the property is not sold within some reasonable period of time, I mean, is it,
What he chooses to do with the property, I would think that is a matter of concern for the board. I think the board needs to weigh the dangerousness of the property within the order. There's a declaration of dwelling being unfit for human habitation, is or may become a nuisance, and or is or may become a cause of sickness or home accidents to the occupants or to the public. And you would find that immediate demolition or removal of the structure is essential to protect the health and safety of the neighborhood and the public. So I point out to you that all three of those initial factors are present, as well as the last item, an immediate demolition by the responsible party should take place. In accordance with statute, we could not take action, further action on the order to abolish until 90 days has passed.
Can I add to that? I think Mark has summarized that pretty well. One of the things that chapter 111, section 127B requires preliminarily is a finding that the dwelling is unfit for human habitation. That's incorporated in the proposed order. So I'm asking that you have a motion just on that topic alone. The second one, and this follows up with Mark says that typically you give somebody 90 days to correct the issue. And when Mark is using in the order the words immediate demolition, that means that there is an exigency involved or an urgency involved in getting this building down. And that's a finding that I think should be made as well. So if we could have a motion on the unfitness for human habitation and a motion on the immediacy. And then, of course, if you choose or approve the order, I'd like to see those in place.
we have a motion to, well, actually, I had communicated with Scott Casella myself via email, and he basically told me the same thing that he told Mark, that he said he would not go into that house, and I trust Scott. So I make a motion to declare 8 Valley Street unfit for human habitation.
Second.
Any discussion, any questions?
No, I think it's pretty clear from the pictures there. And from Mark's statements, it's pretty clear. So.
Joyce?
Yes.
Pete?
Yes.
Dave, yes, so unanimously, a dwelling is considered unfit for human habitation. And then the second motion would be a motion, an order for immediate demolition of 8 Valley Street.
Well, the immediate demolition is in order to demolish, but if you could have a motion that is indicative of your feelings that there's an immediate danger present unless this building is brought down, it's urgent. So if there could be a motion to that effect, that there's an immediate danger to the neighborhood. I think Mark has phrased that previously like that, to the health and safety of the neighbors, something to that.
So that I move that in the judgment of the Board of Health, based on our understanding and Officer Blaisdell's report, that the dwelling is indeed a danger to the neighborhood and should be demolished immediately.
Second.
Any further discussion?
I have a question about, again, the process of this as far as financial implications. Is this, where does this come from? And if it's the town, do we have money for that? Yes.
So it is not an order for the town to demolish. It's an order for the responsible party or parties
Correct.
to demolish within 90 days. If they do not, then the municipality may pursue the demolition of the structure. Typically, unless you have a consent from the owner to enter onto the property, which was the case for a Summer Street property several years ago. So if the homeowner didn't grant that consent, then we would have to take the matter to court. The court would hear opposing views and then render a decision. In Pittsfield, there were 2 such occasions where the court did allow the municipality to demolish property and then place a lien of those costs on the property deed. So we're not talking an immediacy after the 90 days, because you still have those processes to go through. And then you would have to secure the funding to do that.
Yep.
So the only responsibility we would have after this, if Mr. Bishop was not able to sell the property within these 90 days or even afterwards, it still retains ownership. And even while we're going through any court action, we could always, as an option, pursue receivership. So there's alternatives for us after those.
Joyce?
Yes.
Yes.
Me and Dave, yes. So unanimously, the motion passes. So thank you. Is there any further?
Yes, so that was the motion. The second for the, so we're declaring the
Unfit
immediate
and immediate danger, right?
danger to the public, so now we would just need a motion to approve the order to demolish.
I move to approve Officer Blaisdell's order to demolish the dwelling at 8 Valley Street.
Second.
Any discussion? Joyce?
Yes.
Keith?
Yes.
Dave? Yes. Unanimously passes the order to demolish. You may now issue dated today, 29 October. Okay. Well, thank you. And I wish you the best, Mr. Chook, and moving forward with the property. Thank you for working with us. Anything else? Okay. Well, thank you. Next order of business, I do not see the Sharons. I did communicate with the Sharons regarding their desire to have us create a special permit to allow pop-up cigar sales booth at town events, such as Ramble Fest. And Attorney St. John, also Blaisdell, myself, spent a fair amount of time investigating possibility, listing language, this, that, and the other thing, and seeking input from, for instance, DJ Wilson. And we have come to the conclusion that the phrase in our town code, which we have a copy of here, that
Okay.
establishment must be in a permanent, non-mobile location in order to sell tobacco products. That exact phrase is from the new tobacco law of 2019. So it's not like we can pull back from that. That is state law, and as such, we discussed about, well, is it possible to redefine non-mobile or permanent in such a way? And it was decided that no, the meaning of those words are obvious, and it did kind of remind me of someone who asked what the definition of is, so that yeah, I think we are all together that this is not possible. I don't know if we need to convey that to Sharon in any way. They're not being here, they were on the agenda.
Yeah, it would probably be a good idea to, maybe if you can send them an email.
Or what do you see, just an email or just a letter?
I think you could send an email. If you're acting on behalf of the board, you could probably send an email saying that the board has discussed and whatever conclusion you come up with, which I assume is that it's not possible to create a permit under these circumstances. And given the fact that there's a 105 CMI 665.040.
And so we don't really need to take a vote on that, but it's just, we agree with that interpretation, you agree with it.
Right.
And that we all agree with that interpretation, and they, of course, have a right to appeal, but that's,
If you're not taking a vote, then there's nothing for them to appeal, but if you take a vote, there is something for them to appeal.
right,
Right, if you have a consensus and this is the direction that you see, then just do it as a consensus.
right.
Yeah, because I think it was more an inquiry if this was possible. Right. And that's where there was no official application or anything.
There was no application for it.
Yeah, so I think it's just more informational, so I don't know if we want to vote either. And that's why I say, my opinion, email would be fine. It's just the information, it's not a formal rejection or anything, so.
Just to make sure, I copy everybody in this room, including Mark, except for Mr. Cowie. So everybody else is on the email, then it's just nobody else communicates that way. It's just me communicating, letting everybody else know. Okay.
You're not inviting a response at all. If they get a response, you have to shut that down, because you're not going to communicate by email to
Right.
everybody else involved.
Right. Okay, well, and our next order of business is, well, I have it here, is public health directive.
Can I back up from that one minute?
Yes,
What happened with 103 Friend Street? And was that?
that's on hold because we told them
Oh, that's what the
that
whole.
we didn't expect
Okay,
in 2 weeks, so we wanted to give him until the next. So I'll be here just to catch us all up to.
Sorry to interrupt, I just wanted to make sure.
Yeah, no, that's, yeah, so I sent you all a copy of this. Mr. Cowie has not seen it yet. See how we, there we go. So these, I'll just give over these because these data are like 10 days old now. The next report comes out tomorrow, reflecting the 2 weeks ending 5 days. And so there's a 10-day delay anyway. I did want to point out the last county, this would be 2 weeks ending September 15th. We had 321 cases. And you'll notice that Pittsfield represented about half of those cases, which is a little bit higher than their population. But Adams at that time was 16, which is not, I mean, except for unlucky towns like Sandusfield, we were the highest of the municipalities. And this just gives the right, this end with 16. And Mr. Cowie was right a couple weeks ago when he said that we seem to have peaked. Fingers crossed on that. You'll see that 2 weeks ending September 18th, 16. That's down from the previous overlapping 2 weeks, 23, with the highest being the last 2 weeks of August. And this is a daily incidence graph. Basically says the same thing. This was the previous chart that I showed, where the 88 cases up through mid-September, 19 of them were children under age 12. And Nancy Slattery, our public health nurse, gave me updated for September through the 28th, there were 25 cases. So again, that's approximately a case per day, down from like 2.5 or 2 that we were running earlier in the summer. And she broke down the cohort by age cohort, that 5 of them were children under, well, so that's 20%, so basically the same percentage. 5 in the 21 to 40, and then there were 15 that were over 40. She noted that 11 of these 25 were unvaccinated, and obviously the children were not vaccinated. So that meant 6 of the 20 eligible for vaccination were not. So I scratched my head on that. I said, that seemed like a lot, but that's approximately the unvaccination rate in the county. 2/3 of us are vaccinated, 1/3 are not. So take that information however you want, but it just seems like both vaccinated and unvaccinated individuals are contracting COVID. But we do know that if you are vaccinated, the chance they need to be hospitalized is almost zero. The hospitalizations are almost always in the unvaccinated. And then I put 3 masks here that I did show these, I think, a couple weeks ago. And I am suggesting that we put these masks as examples on our website for businesses to download and post as they see fit. And I also had 3 from Jeff Kennedy, which I can show after review Pete's advisory letter. Any questions or further thoughts? Invite Mr. Cowie if he has.
I guess, well, I haven't seen the order, So, just, can you summarize it for me, because I think it was gonna be rewritten.
Oh, it's not an order, it's just, so,
Is it a recommendation?
it's an advisory, it's just,
Okay, okay.
I
So
thought
that
that
was-
if we can get there, David, can I just,
So, I would, I guess what I would.
So in other words, you're like-
I'm gonna turn the floor over to Pete to go over, what I would like to say, our numbers are going down.
Excellent.
And I would like to attribute that to people actually being careful and wearing masks. And so
I think we can.
my own sort of wish is that we keep masking until the darn thing goes away. I will leave it at that and turn the floor over to Pete to did a very nice rewrite of this long directive and cover letter and put it together into a nice narrative.
yeah, so I guess my thought was, as I got the task to rewrite this, I just reflected back on our previous meeting and having public members here, and what I got from that is that they just felt like they were kept in the dark with numbers, and looking at our website, there's nothing on our website. So my thought with this was just to provide information on our website, and this letter would just kind of be an introduction or advisory, and just restate all the stuff that we have been talking about. But to have links to different information, and the stuff that you put up there, I think is more important. Like the numbers in the county, the numbers in Adams, and we can just update that as you get that. And that's where I thought that we should be going, because I think when people get upset and nervous about this, it's because it's a lack of having information. And so we can just say, if we get calls to the office, Mark might get the calls, or we get an email and just direct them to this link and say, these are the numbers, right? We're not hiding anything. It's all out there, but it's just an easier place for them to find it. And it's organized in a way that they can see it easily. So it's not an order, it's not a directive, it's just a letter stating, basically my intent is, hey, this is still going on.
This is serious.
Protect yourself, and by the way, here's the numbers and here's some more data if you want to click on this.
I guess my whole problem with this thing all along is really bad. You never find out. Like if you look on iVirtues, you see that curve. Okay, and if you look at that, every time they talk about the cases, they just keep piling up. But they never really tell you how many people have recovered, how many were, in order to get how many people were recovered, who were they? Were they in nursing homes? Were they working in the hospital? Had they been traveling? All of this is like information I think we should have, at least from the town's standpoint, like how many cases do we have? How many recovered? If anybody died, how many died from the town of Adams who wasn't in a nursing home? Because I'm 82. I have a number of friends that have gone and they passed in nursing homes. But there was no place they were going to go, they were stuck. But we just don't have the information. And it's kind of irksome because you're asking us to follow your advice. Well, we don't know what it is we're being asked to.
And that's what I gathered from everybody's comments. So that's where my recommendation with this, narrative, I guess, that I wrote is that if we can just provide a spot on our website to have this information to the public, that people are asking for it, and so they're not kept in the dark. That's all my intent with this. And I put, links here to certain things, and obviously we can discuss what you want and what you don't want. Maybe there's things that can be added. But certainly that Mr. Cowie had said is, the Adams specific data I think would be useful. And David, you have it all right there. You get an update every week, and you can just exchange
The
that
only
out.
thing that Nancy generally doesn't give me hospitalizations or the deaths.
We'll get that from,
And then, but that's a delay, and I actually don't know, I have not seen a list of deaths from that.
yeah, I haven't either. That, you know, when you said that, that was one thing. The only thing with deaths is countywide, I think. And then that information that Dr. Joyle sent.
Well, up until a few months ago, the state, on their website, if you knew how to navigate the portal, you could find something.
Yeah.
But they stopped doing town and city information, I want to say maybe 3-6 months ago.
Right.
So anyways, I'm saying that it might not be everything what they're asking for, but at least it's something. I think it's better than nothing. Right now, we have nothing on our website. And we haven't had anything on our website, which we should have. And that's, I think that's on us. We should have stuff.
So I'm not complimenting the board, you know, for the concern. It's nice to have some information coming back.
Right. And so I need to make sure that what we put up is
Well, it's just numbers. You're not putting names or addresses or anything like that. You're just putting numbers.
if there are too few, they don't put the number, they just say less than, but,
Right.
let me find out what we are able to list. I'm sorry, Pat, go ahead.
So Dr. Rhodes had to spend some time to put this data together. So there's no one source that any person can access or they want to have all the information that Dr. Rhodes just now presented. And I always felt that we should have it either posted out front or posted on our website, town numbers. Okay, now today, we're not, since the state of emergency ended, we don't get those, as Dr. Rhodes says, that our public health nurse isn't giving us the numbers, can't give us the numbers. She may even give us the numbers, but she can't give us the locations. And you're getting the locations, not the names, but the locations before. You are accurate in saying that we never got hospitalizations before, we never got deaths before. We do get our data from that data, which is incorporated within county statistics from Berkshire Medical Center, but those are only cases from Dr. Doyle, Berkshire Medical Center, not necessarily Bear County, so it's actually a misnomer. And then that data comes on at different time too. And then you have the state's data that comes on its own data in itself. So none of these sources are synchronized. So when you
I understand that, and that, sorry to interrupt you, and that's been I'm gonna say this politely, it's been a mess since the beginning. And, but I'm still saying something up there is better than nothing.
so
That's all I'm trying to say.
yeah, and as I say, you know, we have.
And we can certainly have our public health nurse give us numbers on a weekly. That's easy for her to do.
Yeah.
And post it. Simple as that.
Sure.
And that's just say, positive cases in Adams today.
Sure, and that's only for the people that have access. I think it would be more visible to have it on the placard up front.
Yeah.
Number of cases as of whatever date. Okay, that's only Adams. Now, one of you three, I can try to make it the point at one of the prior meetings, that our community is not just made up of residents. Okay, you have people who live in Adams, but work in other communities, people who live in other communities, work in Adams, you have transits, you have tourists. So that one number out there, you know, if there's 4 cases, they put less than 5, that number is not accurately reflecting this community.
Let me check with some colleagues about what's the best way that we can, and allow the way that we can give. That was one thing I heard, is like, when I talk about county numbers, I talk about state numbers, and it's like, well, what about Adams? And and I hear, I mean, I feel like I'm a Mercer County, not that, but that's not me. I understand that people want to know what about my neighbors. And so I'll find out what's the best way. Let's put that together. And do we need, can we, your letter, can you say something about on the website that we will try to keep updated COVID numbers on the website, on this website?
Can I? You mean, you want it on the website?
No, just, the letters sort of say, we'll try to keep you apprised of current.
Well, I think it kind of already says that, if you just, look at the bottom and just, this is the links, and we can, maybe add it and say most current information rather than COVID information.
May I add something?
Yeah.
So this letter is gonna go out on its own, if it does, if it gets approved, go out on the website. Say, here's this and here's some links, but should we go into a state of it gets worse, a new letter has to go out. I'm thinking about separating the two things. You have your letter, and then you can have one link to say, go to this for specific data information. So it's not all on just letter. So it's more visible on the website. where you can find the information.
Yeah, I don't envision this just being pasted up there. I envision it being organized in some
Okay.
fashion that I don't have the skills to organize a web page,
Over
but
mine? Yeah, that's
yeah,
mine
but-
too, but
yeah, I don't even think it has to be a letter format. I think it's just a statement from
of information.
Board of Health
about
and
COVID, right.
this is our plea, is please follow the guidelines that are set,
Mhm.
get vaccinated and all that stuff. And then, for more information, here's some links, and then it would.
I
take
see
care-
it now.
Yeah.
Yes, thank you.
That was but I don't have the skills to organize a web page.
There's just one button.
But, yeah, that was kind of my thought. Again, my thought was just, can we at least have some links on our website or information on our website to provide to the public in a semi-organized fashion so that they don't have to go sift through, the mass.gov thing,
Right,
and you're clicking 50 times and you're still not finding what you need. And we can just find that and we can check them regularly to make sure that the link is still active. Good. And that's all, that was my thought, and again, it's just a draft of ideas, and I'm welcome to
Mhm.
other people's ideas and.
I see the vision now, thank you.
So,
So
I appreciate it.
you did say at the end, well, two things, active cases and Adams. And, so that would be a separate,
That would be a link, I just didn't have a link to anything.
and then research, actually, if you could drop that into, maybe put a parenthesis around the CDC, because, I just pumped those off the CDC website. They have a whole series, and I just picked the top 3. So it was, and you can download them, download the entire article, so, so just include that in the CDC. Also available studies regarding masking, vaccinations, et cetera, et cetera. And then finally, it's the signs that businesses may post. And what was the other? Yeah. And I think that, I think that would sum it up for the people that see. Just put signs in a folder, example signs in a folder. Like the, those that, that Jeff Kennedy sent out to his colleagues Valley, his businesses in Williamstown. There's one, and then I think more to the point of, I lost it.
Well,
See if I can pull it up here, so.
If I could just go back to the data for a second, I think we just need to be very careful that whatever we put up here is very clear and succinct, and not everyone knows how to connect the data pieces. So I think whatever method we use, we have to make sure it's just very in the message that we're trying to send.
Right.
yeah, and you make a great point, because, you know, even that introductory narrative or letter, whatever we call it, you know, it doesn't even need to be this long, what I wrote, because people aren't gonna read it. You know, being a teacher, I know I'm this teacher, you know, that stuff, that's too long. So, you know, we can even, you know, like I said, it doesn't have to be a letter, it could just be a, you know, just that second paragraph, bullet points, and leave it at that. Make it just short and sweet, and hey, there's some more information, and just click this.
Okay. So, data, example signs, and revised letter. Do we need to, yes, we should have a vote on revised letter and accompanying material. I have a motion that Board of Health adopt each advisory letter as revised and with accompanying material signage for businesses and updates on yes. And so for a second,
Second.
any further discussion? All right, Joyce,
Yes.
Pete,
Yes.
Dave, yes, it passes. Thank you so much, Pete. You got through a big log jam, and I think it's great to be moving forward.
So do you want me to work with Haley, have this up, or do you want me to just send you the revised? Work with Haley, or-
Probably, yeah, because I'll put together a folder of the signs and try to figure a way to get the, yeah, so if you did that, that'd be great. Yeah,
Right, because he's going to be getting the updates from Nancy or Leslie.
Right, so at least I can get the template up there with Haley, and then he would just be doing the updates.
Right, and are you on calls with Dr. Doyle?
When I can make it,
Okay.
I,
And are you on the email list? Get that data?
yes, because I get the link for the call.
Yeah.
Or not the link, but the number and the passcode for the call. But yeah, that little graphic that they send me, I get that. We didn't get one today.
So, so we'll get actually those numbers, this week's numbers, we'll get tomorrow, Friday, and then Monday, or Tuesday, we'll get EMC stats for the rest of this.
Dr. Rhodes,
yes.
one quick question. Is Adams going to be the only one working?
No, I'll probably do, let's see, do I still
I
have?
don't know where it counts.
Seemed like I
Putting
thought I
information
saw
on-
earlier
Oh,
that
putting-
on there.
Oh, the only town putting it.
Yeah, in other words, what you're gonna be doing.
Yeah, I don't know. I will call around and see what if some of the more active boards. I know Sheffield is active, obviously Tri-Town is active.
Well, I mean, as you mentioned, I mean, everybody realized you got room day here, you got traffic on both ways, and it's still more than, so.
Right, what do, you know, what do other towns do?
Yeah, I'm sure a lot of communities, as Michelle stated, at least put up county stats.
Yeah,
I've
Since we're, David, if I can, since we're still on the website, I noticed that our names are listed as Board of Health, but there's no link to our emails. Are you all okay if I ask Haley to update that with a link to our emails?
I would, yes, absolutely. I thought, for some reason, I thought they were, and
Yeah, I thought they were, and it's not, it's just
no,
nothing here, so
all right.
I think they were at some point, might have inadvertently got taken down. So, Joyce, you're fine with it, with your email? So, all right, so I'll ask her to make that change as well. Okay, thank you.
So you were asking if other towns or cities are putting their specific information out?
Right.
Pittsfield does.
Pittsfield does.
Oh, Pittsfield does.
Yeah, they have a dashboard.
Oh, that's, yes, okay.
Yeah, you have to-
Okay, yes, I have seen Pittsfield does, and there's one other town in Western Mass, but I think it might be east of us. At least from the Public Health Institute of Western Mass. It was, I don't know whether it's Greenfield or whatever, but yes,
Public can access the one in Pittsfield without, because a lot of the dashboards in the state, you have to be, they allow you in or they don't.
Yeah, you can, it comes up with just go to the, their site website.
Yeah.
yeah, I think the URL is publichealthwm.org. It's the Public Health Institute of Western Mass. I think actually if you just go to Public Health Institute of Western Mass, it'll give you the URL, and they actually have a Berkshire County specific, because they do all 4 counties. So that's where I get some of my information there. But again, by the time you get it, the information is over a week out of date. So that's frustrating to all of us.
I agree, it's better than nothing, at least there's
Yeah.
some data there.
You know,
But that's how it's been all along.
Yeah.
So that's no different, really.
Yeah, I don't think there's any way we can get up to the minute data
Right.
up there, it's just,
Okay, moving on, there are 3 hearings. 172 Howland, 76B Howland, and 25C Pleasant Street. Are there any updates on any of those?
Yes,
Okay, good.
so 172 Howland Avenue. All those corrections have been made, so that case is closed. 76B Howland Avenue and 25C Pleasant Street, those conditions remain the same. So those corrections are still
76B.
76B Howland Avenue, the condemnation order, so nothing has changed there.
Have you been able to visit them?
I contacted the occupant.
I think, wasn't that the one where you had trouble with the owners or that one? Yeah,
Yes.
and so you
So I called the, yeah.
you have been in
Right,
communication.
so I called the occupant, nothing has changed there. And in either of these cases, the owners have not petitioned the housing court, district court, superior court, as far as I know. So that's stagnant. Those 2 cases are stagnant. Just relying on the occupants to move forward.
So I will keep them unless I hear otherwise. I will keep them on the next agenda. But, so the next order of business I have listed here is the community health program for CHP mobile vaccination van. Seems to be Anthony, seems like this past August 21st, they did come and they were able to vaccinate 8 people. Mostly, I understand it was school-age children brought by their mothers to get them vaccinated. And I have made inquiries on an upcoming event. It was too soon for them to come, for instance, to the motorcycle rally. And it was, I'm blanking on the other event that, but we were targeting Randall Fest, and CHP is unable to get staffing there. I think there were 4 staff members on the van when it came to SBA, and because it's a holiday weekend, they won't be able to come. But I said, I told Kate, I communicated with her today, vaccination. So that's really a message we need. We need to get out, and it's not like you need to wait for the van to come to your door to get vaccinated. You can just call up CVS or Walgreens. There are multiple opportunities. It's just, you got to do it. And that's the only way we are going to shrink the epidemic, whatever you want to call it. A municipal grant opportunity for air quality sensors that is now dead in the water. We were unable to put together a package in sufficient time to meet the deadline. And so we will say no more. We need to say no more about that. New business. Cannabis tab for our webpage. Kind of think we have enough on our plates right now. We could postpone that for another meeting. I'll see what I could maybe put together for information. Does that sound reasonable?
Yeah, I think, since we just had talked about putting COVID numbers up there, I think we should concentrate on that instead of
Not that we can.
cannabis. I think right now that's more important.
Right. And we talked about water department and the remaining item there, designation of Mark Blaisdell as our agent. And I have been asked by town administrator Green and Attorney St. John that we postpone that pending further discussion amongst a number of us, including Board of Selectmen, in order to get a better sense of the need and the meaning, the ramifications thereof. And so I did agree that we have been trying to meet back and forth, and I am hoping that this will occur between now and our next meeting, because as I said, I myself was concerned. I won't say anything more now. I'll hold it. I had concerns, which is why I brought it up. I will say that. Local and county updates. Public Health Alliance. Don't really have that much to report from there. We met earlier this month, and we'll meet again in November. The Alliance is actually will be 10 years old. And it's going strong, especially now with additional funding from the state. And they do provide us with public health nursing well as, septic inspections, as needed. Community health initiative, and did either of you look? I think we all got the email. I was, it was supposed to be September 10th. That was a while ago. Okay.
The one that First Shuttle Systems just did.
No, that was a different one. And I think it is. I think you're right. I think that was, did you?
I went,
You did?
and they held the second one last night.
And how was that?
It's interesting. The best I can say.
Okay.
I mean, there are a lot of concerns that are coming up across the county, so I think that right now, I think I just received an email from Kim Kelly asking for feedback. So I take over. I have copious notes. If you ever want to hear my copious notes, but I just didn't bring them with me.
Oh, okay. So.
If I had known, I would have.
And then the new member orientation was yesterday.
I've been fully oriented.
You are fully oriented. That is good. Yes. I mean, it's,
I'm not gonna say I can spit it out, but I'm fully oriented.
I will tell you that I continue to learn, and it's amazing how much there is to all of this. And, upcoming events, did
I just had that one that I sent to everybody here. Speaker at MCL, I had Jamie Ducharme. About the book that she wrote, so.
the big.
Yeah.
Yeah.
So I just thought that might be of interest to us, so, okay, so it's both in person or virtual. That, you can sign up with that link, if you want to. And again, if you know of anybody who might be interested, feel free to send them along, so. That's the only thing I had.
And I got an email earlier today, it was, yes, today, support local public health funding, take action today. This is regarding, committee local public health dash ARPA funding request. There's, if you didn't receive it, I can,
Oh, I see it, yeah.
I can send it. It's really easy. You basically just plug in your name, and say, Adams Board of Health or whatever. And that was the only other thing that was sort of upcoming at the last minute. Oh, we go on to reviewing mail. Mark received a query from a constituent regarding a Halloween party at Elks.
Well, that was actually an Elks member. Asking if we had any plans to implement any restrictions or guidance for Halloween. So she replied that they may very well, the Elks, the Adams Elks, may very well hold an event for children. And then I forwarded that on.
And it would be outside.
Yeah.
And that's.
Well, they could hold it inside if they chose also, and restrictions in doing that. But I also shared that also with the chief of police. Since last year, it was during the pandemic and we had
Right.
the event with the then police chief.
And then just discussion among other county colleagues says that apparently people are okay with house to house trick or treating. And so that's basically just the standard, no close contact with someone you don't know. And
Well, we'll have another meeting if the board wants to put something out formal.
yeah, yeah, things may change in this few weeks anyway, so. So, anything else that you got that's,
Well, I just want to thank Mark for sending that email earlier this morning, the booster information. Appreciate that. So, yeah, I was able to send that along to.
Yeah, and you know, it's funny, I had to go to Walgreens
Yeah.
for some town hall medical supplies. And there was a line there. People were waiting to get their booster
Yeah.
vaccine. So earlier in the morning, they had changed from Wednesday. And then just in a matter of hours, it apparently changed again.
What's changing? What did I miss? I might have missed something.
So there's been authorization for boosters,
Right,
for certain
for certain
persons,
individuals, right? Mhm.
And so as of Monday, there was a more comprehensive list of availability,
Eligibility, you mean?
availability
Oh, okay.
Appointment.
for different facilities in northern Berkshire County. And this morning it changed, it diminished. That number of available establishments diminished.
Okay,
And so Monday, our Walgreens was listed as having available appointments. This morning, no establishment in Adams was listed whatsoever. And then, like I said, I had to go, well, you know.
yeah,
Uh,
yeah.
So there was this long line and they were in my way. So, what are you all here for?
you need a siren.
But anyways, thank you for sending that
Yeah.
along. Appreciate it.
Well,
And it's just for Pfizer, correct, at this point?
Yeah, there was an eligible list, which is 65 and over. And those, I think 50 and over was comorbidities. And then there was another like, if consult your physician kind of, at your physician's suggestion. So that was comorbidities under 50. And I forget what the other.
persons in nursing.
Oh,
And then if you work in certain establishments.
yeah, but public facing, yeah, that, so I like that it wasn't sort of cut and dried, it was sort of like a sliding scale. And, but me and Tony Fauci, we have Moderna, so not yet.
Yeah, that's what I had.
Great, yes, thank you. Next meeting. I was thinking, I think the 13th of October or the 20th.
Well, is this technically our October meeting or not? Since we already had one in September.
Oh, we had 2 in September.
We've had 3 in
Right,
September. Let's.
Well, I guess,
rephrase
yeah,
that.
because I missed one.
And,
And the 13th is only 2 weeks out.
oh, right, and so I think that's why I put 13th or 20th. It depends if we want to make some statement about
Yeah, good point.
yeah, I would, and the 27th is getting close, so I was, and
I am available both days. So I have no,
yeah, let's aim for the 20th. And, because we have an advisory and not this directive thing, it's less important for us to kind of review it periodically, but it will give us a chance to update it formally in the meeting. Anything else? Do I have a motion to adjourn?
Motion to adjourn.
Second,
No discussion, Joyce,
yes.
Pete,
Yes.
Dave, yes. So here we are at 5:20 PM, 29th of October, 2021, adjourning our meeting of the Adams Board of Health. Thank you all. You may stop the recording.